Vaccination was the strongest tool that we could leverage. Taking vaccine to each and every person to the last mile, delivering to that point was very important. That's what the project and many other partners, our subawardia NGOs have done here. So that is one strong takeaway. Also, I think now with IMI5 coming, with all the more effort and push nationally, earlier we would have it in zones and only with the breakouts or outbreaks have been. But this time it's national, it's happening in 3 rounds, it's a push that we all are coming together. Nagaland has a good fair share, I mean the numbers are very good, unlike many other states, so this is one strong point. And from media, I think we see a very strong catalytic role that media can play, driving the positive messages, bringing out those stories that promote vaccination. We see a lot of vaccine hesitancy in many pockets. So a lot of interpersonal communication work will be required, which the partners and projects and sub-bodies will be doing. But what media can bridge the gap, nobody else can do. Spreading the right message to a larger audience, that is what the power is there with you. The power to create awareness with fact-based messaging. If there's a rumor or a myth that's prevailing in a community, an immediate positive story can turn that rumor around. You can promote the caregivers, the mothers, to come and get their kids vaccinated. The families need to be engaged. The larger groups need to be a part of it. Community influencers at the level of community, at the districts, if they can join forces, or if you can create champions from them who can advocate for the cause, will be very important. So this is one step, this conference, to share what all government is doing and this lot that the government is doing. Digitizing this with the population size of our country is no mean task. I mean, of a population of 130 crores and getting a digital application to get kids enlisted into it, figure out when is the next vaccination. It is a mammoth task and government is endeavoring to it. All that we require is the support of the partners, of our allies like the media here, multi-stakeholders to come together and make this a success. Make it adoptable, make it possible, what is going to probably solve a lot of problems as we go ahead. So this is the key ask, and we are very grateful to the support that media has given in the past, and we look forward to your support in the coming months, the coming times also. So thank you so much everyone for coming together here.
I mentioned that this is not the first time that we are having Intensified Mission Indradhanush. It's been many years, it's around 8 years with several rounds, and these dates and strategies are decided by the ministry. Because even if we have been having this routine immunization program since the 80s, our country still has this challenge of not being able to reach each and every child. So this is one of the strategies. This is an intensified immunization drive to reach out to all left outs and dropouts of children as well as pregnant women, because we cover the pregnant woman also under routine immunization. So for this, the health department has already completed all the planning part of the program, like the headcount activity is more or less complete in all the districts. Now, like the due list of beneficiaries, that is also in the process. And basically the micro planning process is in ongoing right now. So what we need this type of workshop is that the planning part, the health department will take care of it, but spreading out the awareness and to create a demand for vaccination, that is where we need the support of other stakeholders. So in addition to these type of sensitization workshops, all the districts, they are also conducting district task force meetings, which I'm sure many of you have come across in the papers and in the media. So that is also one of the platforms where the health department reaches out to the other key stakeholders, namely the ICDS departments, education, the NSLRM. So it is through the help of all these other allied departments where we can increase the mobilization efforts for vaccination. So under the planning process of Mission Indradhanush, it includes good quality headcount and micro planning. And as our state immunization officer had mentioned, this time it is going to be different because it's going to be digital. So we will be using this UN app, which Kingston will be talking more in detail about that. So for that also we need awareness, because you are aware that during COVID vaccination, everyone had to use their mobile numbers to get registered. So now since we're just starting out on UN, maybe that self-registration may not start, but the plan or the strategy of the ministry is that after IMI, for this ongoing routine immunization, it will all be come under UN. So you, me, every one of us, if we have small children, we have the option of registering by ourselves. So for that, that awareness needs to be created, just like how it was done for COVID. So the overall goal, the immunization agenda is to reach every zero dose child. That is the agenda for our country. And also side by side, our country is committed to achieving measles rubella elimination by this year. So for that, we need to have a good vaccination coverage for measles and rubella vaccine, which comes under immunization program. So it is this IMI 5.0. It is a program which we will leverage in order to achieve the MR elimination goal. So this time, the target beneficiaries for IMI are going to be children between 0 to 5 years of age. Earlier it was, all the other rounds we had previously was 0 to 2 years. This time it's 0 to 5 years, so that we can catch hold of all the children who have missed out on MR vaccines, and they should be vaccinated so that we can achieve the MR elimination goal. So in order to make this program a successful program, and for us to increase our coverage, immunization coverage, we need to have good convergence with other allied departments and any other agencies that can help us to spread the awareness about importance of vaccination, and those parents who have either not vaccinated or just partially vaccinated their children, they need to understand the importance and come forward to get vaccinated. Then another priority is that over the last 2-3 years, there have been some newer vaccines that have been introduced, like rotavirus vaccine, pneumococcal conjugate vaccine. So all these are part of routine immunization. So to increase the uptake of these newer vaccines also, which is part of routine immunization, we can increase that coverage during IMI. And as I've already mentioned before, the plan is that once IMI is over, UN will be part of routine immunization only. So that is the plan that the ministry has for our entire country. So in closing, I just want to say that Intensified Mission Indradhanush this time will need the enhanced support of all the stakeholders that can help in creating that awareness. It is going to start from 7th of August, and it will run for 6 working days. So the dates have already been decided by the ministry. So in August it's 7th to 12th, September it's 11th to 16th, and October it's 9th to 14th. So basically that's Monday to Saturday of each month. So during these weeks, the districts they have already handpicked several low performing areas. So in these areas, they will be having the intensified mission Indradhanush. So let's hope that there will be good, there will be a good coverage this time, so that we can achieve our goal. And this type of media sensitization workshops, it's being done in all the states over the last few days. And today we are having it in Nagaland. So we hope that there will be good coverage of this program through the media. Thank you very much.
Registered. So like the mail, we can be as a guardian. And for these, one mobile phone can be used for 10 beneficiaries. I'll come to that. So new registration may be done for pregnant women and citizen. All children, including infant, I have mentioned, appointment, download, it's just a repetition. So these are the certificate that I was mentioning before. Immunization schedule on the left side is for the children. Wherever it is thick green, that is, you have received that vaccination. And the red one will be the tube vaccine, which is, which the child is yet to be received. So this will be automatically filled as per the mobile phone or, the registration you have already done in the COVID vaccination. And we have a provision for people who have not taken the COVID vaccination, we can do the fresh registration. So yeah, I just show you the self-registration module because this is going to be very important during the RI session, routine immunization session. Sir has also mentioned this is the website uwinselfregistration.mohfw.gov.in. But with your support, we will be giving out more this one. Already registered women in UWIN or COWIN can be tagged as a pregnant women. So as per the details, that is already given. And I've mentioned the 10 beneficiaries can be automatically use that mobile phone. So we don't have issue of, oh, moi lapostide, I don't have a mobile phone, but you can even ask the pastor's mobile phone to register because it's entitled for for 10 beneficiaries. In COVID May, it was given 4, but last we entitled for 5 beneficiaries to be registered. So yeah, this is going to be the website from ministry. This look exactly the same. I was mentioning before that uwinselfregistration.mohfw.gov.in. You just need to enter, you have to just enter your mobile phone if you have taken the COVID vaccination. As soon as you enter the mobile phone, there will be login details. You will be asked to enter the OTP. Once that is set, you submit and they will just say welcome to the system. And all those registration of records details will be asked. If you are female, automatically you will be asked, are you under reproductive age group? If it is male, we will be definitely as a guardian or things like that. So this is exactly as per the interface. We have just taken a screenshot. So you can see the add members. If you are already, if you have taken as a male, if I have taken the COVID vaccination, I can, add other people who don't have a mobile phone and add him or her as the beneficiary for this vaccination. Yeah.
We want to utilize IMI as a bridge to to fill the immunization gap. We have heard about how the state is doing so much, but then we are still having issues with regard to people coming up for immunization. At the same time, with COVID, we have seen disruption in the regular services. So we have seen that there is a group of children who have partially taken immunization, and at the same time there is a cohort who have not taken any immunization also. So we want to take these 3 phases of IMI and utilize it in such a way that the immunization gap is filled. So what is the issue that we have seen? In all the different rounds of NFHS, Nagaland is one of the states where we are facing low numbers of immunization coverage. It's not that we are not doing, we are doing our best, but at the same time, other states are also doing better and going ahead. And in all the different phases of NFHS, the screen, just excuses, we'll just try to see the screen once. Okay, while that is being sorted out, so what is the issue that children are missing on immunization? As our state immunization officer has said, there is a group of people where they have partially vaccinated, and there are children who have not taken even 1 vaccine also. So what is the reason that we see is mostly because due to lack of awareness. Lack of awareness is one of the main issues that we are facing right now when we are trying to reach the last mile population. The other thing is refusal. There is outright refusal also in certain families where they really don't want to take up the vaccination because of some misinformation or some myths and rumor that they might have heard. The other thing that we're seeing is also the AEFI, the fear of adverse events following immunization. I mean, of course, this is, with every vaccination that we see, even during our COVID also, we have seen that there is a small chance of an AEFI occurring, but it is amplified so much that people are very afraid to come for the normal routine immunization activities. So these are some of the things that we're dealing with, especially in terms of fear of AEFI, refusal, and the lack of awareness in the population. And this is where we all can come together to help, allay the fears that is there in the population to ensure that people take up the services that the state is providing. So one of the communication objectives for IMI for this particular round that we're looking into is to create demand for immunization. Like our state officials have mentioned, the services is in place, micro-planning and everything is there. The state is trying our best to provide vaccines and logistics support. But without the community being aware, without the community knowing that there are services that they can take up, there's an imbalance that is created. So the demand generation, the creation of demand generation is very important at this critical phase right now. We also want to look and identify specific communication challenges that certain pocket of population might have. What is the communication challenge for Dimapur might be very different to Kifiri. So the challenges are very specific to district, block, and even to the village level also. As mentioned earlier, we want to position IMI as a bridge to, the immunity gap, and also move towards measles and rubella elimination. So Nagaland, along with the rest of India, were committed to eliminating measles and rubella by the end of this year and attain coverage of almost 95% of vaccination. But without awareness and without support from the community, this is something that we won't be able to.
This is from the head count, okay? So if you, in actual, all the districts will be targeting around 178 pregnant women, okay? And children's 0 to 2 years will be 1,159, and 2 to 5 years will be 763. Now, these are children and pregnant women who have either just received one dose and dropped off, or who have not received any vaccination. The other children and all, like 0 to 5 years, we have around 33,000 something like that, and then even pregnant women around 20 odd thousand. So these are already, they are ongoing, taking vaccination and all this. But this due list which we are giving is for those specifically because of some reasons or other, they have not taken one dose also, or they have taken a dose but they have missed out on the second dose. So the numbers might seem very less, but this is what we say is the end mile. Okay, so like I said, pregnant women will be 178, and 0 to 2 years 1,159, and 2 to 5 years will be 763.
Among all the districts in the state, as we have seen, like there is a low number of coverage, immunization coverage. So, which part of the state has the lowest coverage of immunization?
That's a very tricky one. Actually, among census to na ठीक नहीं हो. Like example, Moksong Kumti as a go, Boka Kumti as a go na. But if you look at the head count, they are okay. ठीक है कुड़े आजे 70-80% है. But census law de saili do, they are very low. So census is 2011 now census as it. It is 2023 de as it. We cannot reach the 2011 ka census. So it's very difficult. But if you look at the head count, our state is doing very good compared to the other states, But it's this census is really troubling us. Not only the medical department, it's giving nightmares to the education department, giving nightmares to this RD department and all this. RD, they cannot find the households. Education also, they can't find the children. So it's a bit very tricky. But 60%, let's just be politically correct and leave it at 60%. Okay.
You've mentioned that the maternal mortality rate and the child mortality rate in Nagaland comparatively is much better in comparison to the other states. If you could tell us, provide the data, and how are you planning to, what difference do you think is going to make with this new intervention now?
Music, maternal mortality.
Yeah, thank you very much for the question. Maternal mortality rate in our state is good in the sense we have very less reported cases of mothers dying due to an event, especially due to childbirth. So maternal mortality is taken technically from the time a mother has the child, gets pregnant till 42 days after delivery. If something happens, if a mother-child during that period of time, then we take it as maternal death. No? But the maternal mortality rate at the moment is quite low. Now the thing is how this immunization is going to improve and also add an impetus, and also it will have an advantage on the health, is because immunization will also prevent many diseases, many communicable diseases, no? And also for the child and plus for the mother, having regular immunization will also improve the overall health of the mother and also the child. So in that way, that will also improve the maternal health of the child, of the mother, and also the outcome in the children. Did I get were you satisfied with the answer, or?
If you could tell us, where do we stand so far the rate is concerned?
The rate, no? See, maternal mortality is usually calculated as one death per 1 lakh population, no? So the maternal mortality at the moment in our state is very low. So we have not yet calculated, since the population is very less, so, but it is less than the national average. So deaths happening in 1 lakh population, maternal deaths, it's, I think last year also there was just about 2 maternal deaths. Some deaths do happen. So to calculate that with just 20 lakh population, so that the rate is very low.
No? So that's why we cannot calculate. But absolute number, like statistics department, village Kamra, Iningabra Kuado, like it's 2 deaths per year, 3 deaths in a absolute number as it na, through our statistics and through the statistics and economic department, Tanbra life and birth laga certificate did na, Tatibara trace Kurado in. So for Nagaland, it is very hard to calculate because of this factor. Not only Nagaland, the whole of Northeast, because to calculate maternal mortality rate, it's this 1 lakh life birth is needed as a denominator. Same thing with infant mortality rate. Infant mortality rate, Nagaland, we are one of the best in the country. It is around 4 or 7, I think so. But that is, again, there is a big problem in that calculation also. But if we go with the absolute death, many children registered who who died and all that, then again the problem statistics probably to pishi komti dikhai, into absolute probably it is still less than the national. It was okay. So maternal mortality rate India is around 140 per 1 lakh life birth. Nagaland laga calculate kurili it comes to around, that is maths, not in absolute. It will come to around 70 MMR, 70 per 1 lakh live birth is not available if you use statistics and all that figure. But in absolute numbers, it is still very less again, as from the statistic department and from the records of the urban and rural areas. Okay.